What we've been seeing for the last couple of years, and I can speak particularly to Uganda's context, is the private sector often being relied upon to step in where there's a sense that maybe the state is not doing what it should be doing. Uganda's National Development Plan and a number of documents, including the Health Sector Development Plan, do talk about, particularly the NDP does talk about the fact that the private sector will help achieve development goals. It's also echoed in the Health Sector Development Plan. In Uganda's case, about 49% of hospitals are private. A new phenomenon, well, it's somewhat new, of public-private partnerships, where government funds are contributing to private facilities to ensure that those who need health care are getting it. The rationale for that has always been that it's more efficient. In a lot of instances, what we are finding is that there are often high out-of-pocket costs, and that for the woman who is struggling to just even afford the transport to get the facility, having to pay exorbitant out-of-pocket costs, yet there is no government facility in the area at that level, and that state funds are being placed in private facilities that should be doing this, raise a lot of questions around equity, which should be a primary focus if you think about like the Sustainable Development Goals. And we're seeing that there's been some discrimination in terms of those that are most marginalized in being able to access those. But also the increasing phenomenon around things like public-private partnerships does raise questions around regulation, what mechanisms are in place, and those are things that we need to interrogate as a country and as a region as we embrace the private sector and say there's a role for them to play. It's important to note that the increasing private sector role must be seen against the backdrop of decreased financing for health. In East Africa as a whole, the financing for health is not where it should be. Years ago, we pledged to reach a 15% Abuja Declaration target, and we haven't met it. None of the core countries. Rwanda is a bit closer. In Uganda's case, it hovered between 7 to 9% for about 5 years until about 2017, where we saw a retrogression, and then 2018, this current proposed budget is about 5.5% of the national budget. And when there is a deficit in financing, it affects the quality of the public health systems. And it also builds into the idea that we often hear that, that these are just inefficient systems, and that, we really should be embracing the private sector. But we don't always question why these systems are inefficient, why our public healthcare systems are failing. And a huge part of that has to be the fact that they're completely inadequately resourced. And we're seeing the private sector come in to give finances. Some of it is off-budget support, some of it is budget support. But the question has to be, where is that money going? And is it in line with our health sector development plans? Is it really going to strengthen the health sector and strengthen a health system that we're seeing failing? Or is it money that is often earmarked to say, we'll give you this money if you deliver these services through a private provider? I think those are questions that citizens and policymakers should be asking themselves about, because they're very important questions. Public systems are sometimes the best way to ensure that there is equitable delivery of these services. Remember, these are services, they're not goods that should be traded in a marketplace, and that the ultimate person, when having benchmarks, when thinking about whether this is a good thing, when thinking about whether we're actually delivering on health, especially when the private sector is involved, I think the ultimate person we should be thinking about is, what does it mean for the rural, marginalized, poor woman that often has to pay high out-of-pocket costs? Is her situation improving? Does she have information to hold those people accountable? And does it ultimately not violate the right to health for the most vulnerable? Ultimately, the state is responsible for making sure that its people are getting health care. And that doesn't mean that it's always providing it, but even when others are providing it, it has a duty to regulate that and make sure that it is not being violated. And so a way to engage is to say what regulations are in place, and beyond having them as policies, because as a region we're very good at having great laws and policies, we're very bad at implementation. The critical question is, first of all, have you put regulations in place to ensure that there is no abuse of the system, and that if you're insisting, for example, that you're investing in PPPs, what is there, what is in those memorandum of understanding? Are certain things guaranteed to be free? such that the community knows this is what is given, this is what should be free. Are your officials at the district level capacitated, knowledgeable enough to be able to check and monitor and ensure that this is not being violated? Because you can have all the best policies, but if there is no actual oversight and regulation, then it is problematic. So for me, I would again go back to the role of the state as the one that is responsible for the delivery of healthcare and responsible for regulation and responsible for ensuring that if the private sector does get involved, that it is in line with the health sector development plan. It is not endangering equity.